Hello, I'm Vinod Prasad Milsina. I'm going to doing the presentation about understanding health promotion theory, practice, and the WHO Be Active and Initiative. Introduction. Introduction to health promotion. Health promotion is defined by the World Health Organization as the process of enabling people to increase control over their health. It's not just about treating illness but preventing it before it develops. The Ottawa Charter, introduced in 1986, laid the groundwork for modern health promotion, highlighting the importance of building healthy public policy, creating supportive environment, and strengthening community action. Strengthening a community action, and at its core, health promotion involves integrating education policy and community initiative to drive long-term behavior change across population. The goal is to create sustainable environment in health by addressing both individual and social factors. And another one, an overview uh, of health promotion models. And there are several key models that guide how we design and evaluate promotion strategy. The health belief model focus on how people's perceptions of risk and benefit influence their actions. The theory of planned behavior explain how intention shaped by attitude, norms, and perceived control predicts behavior. The Tannehill model combine education, prevention, and protection into a comprehensive framework. The ecological model uh, takes a wider lens, showing how individual behavior is affected by relationship, institution, and public policy. Finally, Beatty's models uses quadrant systems to show how uh, health promotion varied based on power dynamic and the target's focus, whether individual or collective. Third, health belief model explained. The health belief model is one of the oldest and most widely used in public health. It's based on the idea that people make rational decisions about their health by weighing the perceived threat of condition against the benefit of taking action. It includes six core constructs: sustainability, severity, perceived benefit, perceived barriers, cues to actions, and self-efficacy. This model works well for specific preventive behaviors like getting vaccinated or going for screening test. However, it's often criticized for overlooking extreme influences such as social pressure or environmental barrier, and it doesn't account for emotional or habitual behavior. Theory of planned behavior. Theory of planned behavior explained. The theory of planned behavior focused on role of prevention in driving uh, behavior. According to this model, three keys factors shape intention, our attitude towards the behavior, subjective norms or social pressure, and perceived behavior control. Essentially how easy or difficult we think it would be. This model is especially effective when looking at lifestyle changes like exercising more, eating healthier, or reducing substance use. It produces a structured way to understand how beliefs translated into action. However, it falls short when behavior is driven by habit, spontaneity, or emotion factors it doesn't fully address. Comparison: HBM's vs TVP. Now it's compare those two models. The health belief model centers on how people perceive health risk. while the theory of planned behavior looks at how intention guide actions. HBM's strength lie in its simplicity and broad public health application, especially in areas like vaccinations and screening. TBP are more complexity by including social influences and perceived control, making it better suited to behavior like dietary change or quitting smoking. That said, both have limitation. Yes, BEM ignores social and habitual influences, while TBP it doesn't predict impulsive or emotional driven behavior well. Choosing the right model expands ex- depends on the health issue being addressed, and I have shown in the figure as well. Introducing the WHO Be Active initiative. The Be Active initiative campaigns was launched by the World Health Organization in 2020 during the height of the COVID-19 pandemic. It was designed to combat the sharp rise in the sedentary behavior caused by lockdown and social restrictions. The companion goes beyond COVID response. It addresses the growing burden of non-communicable diseases and the mental health risk linked to the physical inactivity. Its messages is simply but powerful. Everyone, regardless of age or ability, should engage in a regular daily movement backed by global partners like the United Nations, FIFA, and the International Olympic Committee. Be Active has expanded across countries through social media outreach, toolkits, partnership, and policy advocacy. You can see in the figure as well. And I'm going to another one. Aim of the Be Active campaign. The main aim of Be Active is to reduce global physical inactivity levels by 15% by the year 2030. This aligns with the WHO's global action plan on physical activity. Beyond that numerical target, the companion seeks to embedded physical activity as a long life habit that supports mental, uh, physical, and social well-being. It also aims to make people more aware of the health risk associated with inactivity across all age group, communities, and region. Importantly, it encourages institutions like schools, employers, and local councils to support movement-friendly environments. The WHO also frame physically activity as a basic human rights closely tied to health equity. And another one, smart subject of Be Active. The campaign's objectives are built using the SMART models: specific, measurable, achievable, relevant, and time bound. The headline goals is a 15% reduction in inactivity by 2030 through intervention tailored to local needs. The also campaign also aims to reach more than 100 million people annually via social media using the Be Active tag. It's actively engages over the 1,000 partners worldwide, including non-profits, schools, and employers, who has translated more campaign materials into more than 30 languages to maximize reach. Impact is tracked through the WHO Global Observatory on Physical Activity, which helps measure engagement, policy uptake, and activity trends across the region. Target group and strategy focus. The Be Active targets several key demographics. Primary groups included young people, older adults, office worker, and individual living long disabilities population often at the higher risk of inactivity. Secondary groups including urban planners, educators, and employers, those who influence environment and policy. The strategy includes mass media campaigns, schools-based programs, workplace initiatives, and residing urban environments to encourage active living. A unique strength of the campaign is its use of culturally adapted messaging, which risks relevance across regions. Additionally, it promotes inclusively by addressing gender inequality in sports and physical movement access, particularly in undeserved communities. And another one, measurable outcome result 2020 to 2024. Since its launch, Be Active has achieved a significant reach. The campaign has been viewed by and engaged with by a global audience spanning uh, spanning billions through digital channels. More than 25 countries have now adopted physical activity strategies developed with WHO guidance. In early pilots, nations like Slovenia and Rwanda, measurable reductions in physical inactivity have been observed. The campaign's tools and framework have been integrated into larger regional platform, including the EU and ASEAN health agendas. Feedbacks mechanism such as member state reporting and evaluation framework help continuously refine and improve the campaign for greater impact. And another one, strengthen of initiative. The strengthen of Be Active are clear. It aligns directly with the key sustainable development goals, especially those focused on health and inclusive urban spaces. It's also grounded in strong evidence, followed whose global action plan on physical activity. The campaign brings together multiple sectors, not just health but also education, urban design, and sports, creating a comprehensive approach. It has been designed to adaptable, which allows even low-income nations to implement community-based models. Finally, its digitally storytelling strategy featuring role model and relatively relatable narratives has proven highly effective at engaging a diverse global audience. Limitation and challenging. Limitation and challenging. Despite of its global success, Be Active has some limitation in many rural or low resources area internet access, and while the material are translated into many languages, many they don't reach people in local dialects, which reduce effectiveness in the certain region. There are also structural change, behavioral change is difficult to sustain without ongoing policy and environment support. Funding is another issue, especially in WHO's Eastern Mediterranean and African region, where long-term investment is lacking. Lastly, it's hard to directly attribute behavior change to campaign alone due to the influence of others overlapping factor whose global public health mandate. The World Health Organization was founded in 1948 as the United Nations Specialized Agenda for Health. Its role to coordinate international responses to global health threat, set norms and standard, and provide technical guidance to country who operates in over 160 countries through regional and country level offices. Its work spans a wide range of areas, including vaccination program, emergency response, and the prevention of non-communicable diseases. It also plays a regularity role by guiding national health policies through tools like the International Health Regulation, which are legally binding for the member state. Key WHO health promotion strategy. Who are WHO uses a range of strategy framework to support global health promotion. One of the most fundamental in Ottawa Charter 1986, which laid out the key principle of enabling, mediating, and advocating for health. More recently, the Global Action Plan on physical activity provides a roadmap for reducing inactivity by 2030. The Framework Convention on Tobacco Control is another major success, and internationally tracking treaty tackling tobacco use. WHO also runs in the Mental Health Action Plan, which includes clear targets through to 2030. Across all of these strategies, WHO aligns its efforts with the Sustainable Development Goals, promoting equity, empowerment, and universal health coverage. And it shows in the figure as well. A key example of whose health promotion in action tobacco free initiative launched in 1998. It operates under the framework convention on tobacco control, now rectifying by over 180 countries. This initiative support government in developing policy like tax increases, advertising bans, and plain packaging for tobacco products. Who also developed the Yum Power package, which helps countries implement and monitor anti-tobacco measures. Through the campaign, who has also saved million of lives. Particular strength is its technical support for low and middle income countries, helping them develop nation tobacco control laws and programs. And I'm going to another slide now. It's like who impact on health system strengthening beyond companions companions whose plays vital roles in strengthening national health systems. It supports health worker training in over 17 low income countries and coordinated large scale vaccination logistic through the initiative like COVAX, which has delivered over 2 billion doses worldwide. Who also produce global standards such as essential medicine list and the international classification of diseases, currently in its 11th editions. The tools guide clinical practice and data reporting across the world. In addition, who provides strategic advice on achieving universal health coverage through policy development, budgeting, and system inform evaluation of who effectiveness. WHO has been praised for its fast emergency responses, including during the Ebola outbreak and the COVID-19 pandemic. An independent panel organized its leadership in promoting vaccine equity through global mechanism like COVAX. WHO's data tools such as the global health estimates are widely used by countries to shape national policies. However, the organization faces criticism for being politically constrained and sometimes slow to act under pressure. Ultimately, its impact is strongest in countries where national governments are willing and able to implement whose guidance effectively. Whose role in the public? In the summary, the World Health organization continues to play a control role in global health promotion. It leverages specific evidence, diplomatic influence, and multi-level partnership to create a impactful framework. Who is particularly strong in the norms, offering technical guidance and offering building capacity in member states. However, its ability to act independently is limited by the financial and political constraints. Going forward, WHO will remain a key global partner in the pursuit of equity, focused and resilient public health system. Recommendation recommendation for enhancing whose promote impact. The further strengthen whose promotion impact is several recommendations can be made. First, who would seek greater funding independence to reduce the influence of donor politics. Second, it should expand partnership with local NGOs and grassroots organizations to increase cultural relevance. Third, multilingual and culturally adapted resources are needed to reach diverse population. Fourth, who must extend its digital outreach to low access areas using hybrid and offline methods. Finally, tools better tools are needed to evaluate long term behavior change to measure the true effective of global campaigns. Future outlook for the global promotion. Looking ahead, global health promotion will facing involving challenging climate change, future pandemics, and social inequality will require integration solution who must embedded health promotion strategy it's into border climate adapting and resilience framework. A digital tool like artificial intelligence and telemedicine can improve reach, but they must be implemented equality. Cross-sector collaboration will be key, especially with the sector like education, technology, and urban planning, who changing landscape, whose leadership will remain vital for ensuring a fair, data-driven, and inclusive approach to global health. And I have provided all the references.